Good morning. I'm Dr. George Lundberg, Editor-in-Chief of MedGenMed, at our studios in Santa Clara, California. Professor Paul Zimmet of Melbourne, Australia, is one of the world's outstanding experts in diabetes, and he's here today to talk about a raging epidemic, out of control, of diabetes and diabesity worldwide. He also has ideas what could be done about it. Professor Zimmet.
The combination of diabetes and obesity is the largest epidemic the world has faced. What HIV, AIDS was in the last 20 years of the 20th century, diabetes and obesity and their consequences will almost certainly be in the first 2 decades of the 21st century. In the last few decades, the number of people with diabetes has more than doubled globally. The International Diabetes Federation, using data from my International Diabetes Institute in Australia, recently reported that the number of people with diabetes will escalate from the present 246 million to 380 million by 2025. Despite the warning signs, most governments have been slow to act. Tragically, diabetes is now a global epidemic with devastating humanitarian, social, and economic consequences. Against this background, December the 21st, 2006 was a momentous day for the global diabetes community. On that day, the United Nations General Assembly unanimously passed a resolution declaring diabetes an international public health issue. Only the second disease after HIV/AIDS to attain that unenviable status. Diabetes is a chronic disease which, through its complications, can impact seriously on the quality of life of individuals and their families through premature illness and death. Because diabetes is now affecting many in the workforce, it has a major effect on both individual and national productivity. The socio-economic consequences of diabetes are likely to bankrupt the economies of many developing nations, apart from their devastating impact on the economies of developed nations such as the United States, the United Kingdom, and Australia. Tackling diabetes and obesity is likely to be one of the most important challenges for the global public health community in the 21st century. It's a battle that we can and must win. That's my opinion. I'm Professor Paul Zimmet, Director of the International Diabetes Institute in Melbourne, Australia, Down Under.